Hardy Fiber Cement Siding handles conditions that can cause damage to vinyl. From fire to hail, Hardy Siding stands tall through it all, helping trade professionals look their best when they recommend Hardy Siding and Trim. See the proof at jameshardy.com.
This is Scott Becker with the Becker Private Equity and Business Podcast. We try each day to bring you brilliant business guests, private equity guests, and a lot more. Today we're joined by Amber Walsh, brilliant leader at McGuireWoods. She follows the healthcare world very closely. She also lives in the private equity world, or the intersection of private equity and healthcare. She's going to talk to us today about some of the things we should be watching in the new Trump administration, executive orders, RFK Jr., and a lot more. Amber, why don't you take us away and tell us some of the things that are happening and how we should think about some of those things?
Absolutely. Well, we are sitting here right at this moment, just within the past couple of hours, that Robert F. Kennedy's confirmation made it through the Senate Finance Committee with a 13-14 split. And it's very interesting because it sets up some health policy thinking that you should be watching. A lot of people had been closely watching what Senator Cassidy out of Louisiana would do. He was the Republican that sits on the Senate Finance Committee that was on the fence. And as people may or may not know, there's actually 4 physicians in the Senate. They comprise what is known as the Senate Doc Caucus. They happen to all 4 be Republican right now. And 3 of the 4 sit on the Senate Finance Committee. Cassidy was very closely watched. Ultimately, he gave his support to Kennedy, and that just passed out of committee. And with Cassidy's support, he is expected to now get the nomination once it actually goes to the full Senate. So we come to this moment right here, assuming now that Robert F. Kennedy will be the Secretary of HHS, and soon thereafter, Mehmet Oz, another physician, will probably also be the head of CMS. Obviously, people have been closely watching this flurry of executive activity through a host of orders and memoranda and other proclamations and activities at a moment when the campaign actually did not have a huge focus on healthcare. The campaign focused on the economy and immigration. But a lot of the things that we're seeing in these executive orders should impact the healthcare industry. And we'll talk here about the things that investors should be looking at. But that's really just starting with the moment in time where we sit.
Thank you. So let's dive into 2 of those different subjects. First is Oz and RFK, Dr. Oz and RFK Jr. And then we'll talk about sort of, yes, there was not a lot of talk during the campaign about healthcare, but now there's a lot of talk amongst DOJ, Department of Government Efficiency, Elon Musk, about Medicaid spending and talks of a lot of cuts to Medicaid spending. I don't know if that's real or if they're able to do that, but some of those sound draconian so far will have a big impact on investors. But take a moment on 13-14 vote. What does that mean? Does that mean it passed 14-13? What does that mean in the Senate Finance Committee, that vote, if anything? And, what are people saying about, obviously I have my own opinions about RFK Jr. and Dr. Oz, but what are people saying about these 2 nominations, and what does 13-14 mean?
Yeah, so the Senate Finance Committee is comprised of 14 Republicans and 13 Democrats. And that's reflective of the fact that because the Republicans have the majority in the Senate, they get a chairmanship. And so consequently, they control. And people who had been opposed to the RFK nomination, including very prominently his very well-known family, and of course, Senate Democrats, had been watching Senator Cassidy. He had really been very offended by Kennedy's anti-vaccine campaigns And he was the one that many people thought that if they were going to have a Republican defector from the nomination within the Senate Finance Committee, that it might be Senator Cassidy. Turns out he ultimately got comfortable. Robert Kennedy gave him assurances that he wasn't going to take down the children's health vaccine program and some other things that are quite precious to Senator Cassidy as a physician. And so ultimately, the Senate Finance Committee voted straight down the line on party lines. So what that means now is it comes out the Senate Finance Committee to go to the whole Senate.
Thank you. Okay, now I understand. So 14-13, got it, understood. The next question is the vaccines, like the childhood vaccines, the polio vaccines, all these vaccines. I know there was this incredible amount of controversy over the COVID vaccines, but these other vaccine programs, they must be overwhelmingly very popular in our country. I take it voters must overwhelmingly be very, very positive about them. You always hear about the very, very sad situation where somebody says their child's autism or something else was caused by a vaccine. And that may be possible, that there's a small percentage of that. And that's a horrible outcome. But overwhelmingly, the vaccines and the vaccine programs, I take it, are incredibly popular in our country.
Oh, absolutely. And this is a really interesting moment because you have this tuberculosis outbreak that's happening in Kansas. And you also have the administration, as part of the proclamations that have been made since January 20th, saying to HHS, your job is to control chronic disease in this world as part of the Make America Healthy Again. I do not expect there to really be, and this is one of the things that Senator Cassidy really had to get assurances from, is I don't think anybody really expects the rest of the vaccine programs, set aside COVID, to really be impacted, despite all the things that we're seeing, many of which are creating a ton of chaos, no matter which side of the aisle you sit. I think there is a well-recognized bit of chaos going on. I don't think that vaccine programs are really, truly in jeopardy.
Okay, so thank you. So that's RFK Jr. And there's obviously no shortage of us that are concerned about some of his views, whether you're a Republican or Democrat, particularly on the vaccines. And then in terms of a senator not going with President Trump on any of these nominations, that senator must be very secure in his position or her position, because obviously President Trump carries a very big bully pulpit right now, and people are very concerned about opposing him. And there's a whole list of political bodies that opposed him that have sort of been wiped off the political map, that probably didn't think they'd be wiped off the political map. So people are very probably cautious about opposing President Trump, I take it.
Oh, of course. And put in a very difficult position right now of, on the one hand, they are, if you're a Republican, you are glad to see that something's being done, because there were promises that things are going to be done on day one, and things are getting done. That is for sure. But trying to parse through and give your constituency some degree of comfort and guidance in many cases about just how to run the businesses in your local area, including in healthcare. There's so much disarray for a lot of healthcare providers trying to figure out how to make just some routine operational decisions. And these politicians are in a difficult position in trying to balance all of these different competing concerns, but just the operating the business and knowing what choices to make as any type of business owner, but a healthcare executive right at this moment is challenging.
100%. And even though many people sort of look at it as though they want things done, everybody always wants their things done versus some of the things done. And so that's always very challenging as well, because you want things done, but if you're in the health system world, You want the budget balanced, but you don't really want cuts to Medicaid. So talk a little bit more. Take me through Dr. Oz and what scuttlebutt there is on Dr. Oz right now, and then let's go to the executive orders, Medicaid, and more.
Yes, absolutely. So he is going to be one of the next step. I think Tulsi Gabbard, I think, is going to be, obviously not in the healthcare world, but that's kind of the next step after RFK. I think Oz is expected soon thereafter. And he's going to come into a interesting moment within CMS where let's assume he's nominated, which I don't think there's much debate about that. I think he probably will be nominated. He's going to come into an interesting moment within CMS where CMS has been told, like every other government agency, that they may not abide by their normal rulemaking process. And even prior to the inauguration and the January 21st memorandum that went out from acting HHS Secretary Fink on this, even before then, CMS was feeling a little bit of insecurity about issuing public guidance because of some Supreme Court decisions like the Loper decision. Now it's even more stark that their normal guidance process, healthcare providers writing in, requesting informal guidance, formal guidance in the forms of advisory opinions, self-disclosures, that these things are all halted. And he is going to have to find a way that CMS can still give guidance to healthcare providers, collect on self-disclosures, figure out a way to keep the money flowing in and out, which is not just his agency. Obviously, that's an agency coordination effort. But that's just the basic run-of-the-mill, what the rules of the road are for healthcare providers. And then he's going to also step into another dynamic that all agencies are having to deal with, of course, which is you've got funding issues, you have the mandate to return full time that's going to impact staffing. I don't think that's a CMS specific thing that Dr. Oz will have, but that will be kind of across the board in agency leadership. And then he's also going to have to deal with changing reimbursement policies and help figuring out what happens to citizens who may have been birthright citizens that may now not be eligible for Medicaid. There's a whole host of things that are going to have to be figured out. And he is going to be the one at the top that it rolls up to. So it's going to be fascinating. And there's so much in there, so much very meaty, interesting possibility, disturbing to some, possibility to others to be parsed through.
Yes. And even though these guys have their own perspectives on policy, like, Oz is a Medicare Advantage person, or was. RFK Jr. was an anti-vax person and has all these different thoughts on we should all do it ourselves versus through GLP-1s and so forth. But even though they got their own policy thoughts, in reality, they're going to have to run huge administrations too that actually take care of a lot of Americans. And if they're not run well, and Americans don't get their so I guess the question is that even though each one of these two leaders has their own positions, for example, Dr. Oz came into office, at least before, very pro Medicare Advantage, very pro sort of, I would say, payer-ish, and RFK very sort of negative towards vaccines and very much negative towards some of the new drugs and therapeutics. At the end of the day, they still have to run major administrations, and Americans still want their health care. So trying to hit this balance between their policy thoughts in a big picture, which, it's hard for me to agree with some of them. I'm sure some I agree with. I don't know. I haven't seen them yet. But they also have to run major administrations. So that's a real job.
Yeah, and they're going to be an unusual amount of executive mandates coming down on what you can and cannot do, because that really is unprecedented. Even though executive orders have been around literally since George Washington, there is only one president, William Henry Harrison, who didn't use executive orders. It's not unusual, but the breadth of it, the onslaught of it, and the extensive nature of them is unprecedented. And so Dr. Oz and Robert Kennedy are going to have everything that you just said to balance, plus the executive philosophies that are being pushed down very broadly. And there will be some opportunities in there for necessary and probably overdue deregulation. There will be some opportunities in there, but it's going to be a lot to balance and figure out how to do it and get it done. And this is definitely a moment where people are feeling very, very insecure. And I think a larger body of insecurity, the insecurity runs more broadly, I think, than people expected. And just hoping that you get the right leaders in there that are given enough authority by their applicable executive orders, because some of them really do defer to agencies, that they can make something work where ultimately the campaign promises come true, that costs will be lowered, that you are still getting reimbursement that goes out to providers, that Medicaid benefits still are available, so routine health care can be received, that all of these things can still happen. It's just a very interesting moment.
No, it sure is. And so anything else you want to highlight out of either the executive orders or, I mean, the Medicaid cuts are so brand new, the discussions of this, and Elon Musk saying he could cut out $1 trillion out of healthcare. Obviously, there's obviously a lot of waste in healthcare, but at the same time, there's a tremendous amount of need, and we're short hospitals, physicians, everything else. So this concept of cutting out $1 trillion obviously makes little sense to a lot of us. But hopefully, a lot of this is we're scared, we'll breathe, it won't happen, it'll be somewhere in between.
Yes, I think probably the key piece of advice, just to round it back out to healthcare operators and investors, is just a couple of things. One is not to be expecting a lot of clarity. It's going to be a long time before we get real interpretations of law. That is so at the bottom of the priority list right now for CMS and OIG. Do not be expecting interpretations of law. You're going to have to go more with your own interpretation and gut, which makes some uncomfortable. I would encourage people to really track. There's a lot of executive level activity, including through the executive order process, that is less talked about in the media. It's less sexy. It's more specific for specific aspects of the healthcare industry that are going on. Some probably overdue deregulation that actually may stick and may impact your applicable industry. So we're talking about the nursing home industry and staffing minimums. There's hospital certification rules. There's managed care wait times, things like that, that if you find it overwhelming to think about the big things like, the defunding and leaving the WHO, if that seems overwhelming to you as an investor, or possibly even to attenuate it to where you sit, try to track through the trade associations the very specific things that are moving and may actually move more effectively through the executive order process than in prior administrations through the regulatory process. So that would be another tip. And then I think right now, as an investor and an operator, there are a lot of points of tension that your staff leadership are going to have to balance. Perfect example is that one of the executive orders removed the customary prohibition on ICE and CBP, which is the Customs and Border Protection, from doing on-site raids in healthcare facilities because they were considered sensitive areas. That has been lifted. And so it is now expected that we could now have that activity within hospitals and health systems and physician offices. And they're going to need real guidance in figuring out at least a temporary plan on how to respond while balancing, the Hippocratic Oath and everybody's, licensure obligations to take care of patients, the mission of your hospital, privacy, and then the fact that you may actually have to deal with some immigration officials. There's multiple things like that are going to be tough, at least for a little bit. And healthcare executives and investors who really want to support their leadership are just going to have to find a way to make a policy that feels right and balanced until there's a little bit more clarity. So that would probably be the things that are on my mind right now. A week from now, there may be new things, but that's what I'm focused on right now.
Thank you. And so many of these have different political implications. So, for example, I would say there's probably plenty of Republicans and centrist that are sort of that are probably in between on the World Health Organization and have questions about how it's operated over the years and our money towards it. There are plenty of Republicans and centrists, aside from Democrats, of course, that would be very concerned about large cuts to healthcare programs unless it was really clarity about how we're going to deliver healthcare with those cuts. I mean, so I think many people would be very concerned about the cuts. I think many of us on the immigration side, it remains to be seen, right, what's actually going to happen in terms of deportations, illegal immigrants, and so forth and so on. And whether that means a hospital's got to be concerned that people are coming after the workforce day to day seems unlikely, but can happen, I guess. It's just so many issues that are up in the air, and even across the aisles, different perspectives on many of these different issues. And that's, I guess, what makes it fascinating. From a business planning perspective, I take it's a little bit of a wait and see. But if you're investing in Medicaid businesses heavily supported by Medicaid, like nursing homes that have already been smacked, you I guess want to be careful on taking on debt. You'll probably be careful on expansion and a lot of other things, unless maybe you're in the Medicaid payer area, and maybe it's again off to the races if they look at more of that. But what a fascinating situation and so many things to think about. Amber Walsh, thank you so much for joining us on the Becker Private Equity and Business Podcast. It's always great to visit with you. I always learn something. Thank you very, very much.
Thank you, Scott.